The COVID-19 pandemic really threw a massive spotlight on health disparities, didn't it? Especially in underserved
It
communities.
really did, yeah.
But what if the best way to tackle this wasn't just, providing aid, but actually empowering the communities themselves from within?
That's exactly what we're diving into today. Our mission here is to explore this really interesting Train the Trainer program that happened in San Diego County.
Okay.
We want to unpack how it worked, with immigrant and refugee community leaders, helping them build their skills for policy advocacy.
Right, giving them the tools.
Exactly. And also, what surprising things it showed us about learning, about engagement, and, well, the power of connection.
So how did they set this program up? What did it actually look like on the ground?
Well, it was pretty intensive. It was a 5-session training program. Each session was 4 hours long.
4 hours.
Yeah, spread over 5 weeks. And importantly, it wasn't like a generic program. It was specifically adapted for diverse communities, Latino, Somali Bantu, Karen leaders there in San Diego. They had 16 community leaders taking part, half identified as Latino, and then about a quarter each were Somali Bantu and Karen.
And I imagine with those different groups, bridging language gaps, cultural differences, that must have been absolutely key.
Oh, absolutely critical.
Uh,
Right from the start, they focused on making it culturally and linguistically appropriate.
okay.
So they had translators, interpreters there to, bridge those communication gaps. It's fundamental, really, not just an add-on.
Makes sense. Now, you mentioned surprises. The findings weren't maybe what you'd expect right out of the gate.
No, exactly. It was quite counterintuitive. After that very first session, participants actually reported feeling a bit less confident about policy advocacy.
Less confident, huh?
Yeah, and the researchers who were doing ethnographic observations, basically watching and documenting the group dynamics, they saw something else too.
What was that?
A real difference in early engagement. The Latino participants were, well, initially much more vocal, more active in the discussions than the other groups. That pattern held for the first 4 sessions.
Okay, so a dip in confidence and uneven participation at the start. That sounds, well, a bit concerning. How did they turn that around? Did it improve?
It absolutely did. Despite that initial wobble, the later sessions 3, 4, and 5 saw consistent increases in confidence.
Ah, okay, good.
Yeah, people clearly felt they were getting a better handle on policy advocacy, understanding how to influence decisions for their community's health.
So what's the thinking behind that initial dip? Why would confidence go down at first? Seems important for, any training program.
It really is a fascinating insight. The debriefing sessions later suggested participants might have, well, overestimated what they knew before they started.
The don't know what you don't know effect.
Exactly. You think you've got it figured out, then you dive in and see the real complexity. So that dip wasn't failure, it was actually part of the learning curve, getting a more realistic picture.
That makes a lot of sense, actually, moving from maybe surface level confidence to a deeper understanding. And that sounds like there was a social shift, too. The engagement became more even.
Precisely. By the last session, things looked very different. Engagement was much more equitable, much more balanced across all the groups.
What changed?
Well, one observer put it really well. They said it was likely because they got to know each other throughout the sessions and became comfortable with each other.
The human element.
Yes, it wasn't just about absorbing facts. Building that comfort, that trust, that's what allowed everyone to really step up and participate fully.
That shift sounds huge, moving from individuals learning to a group building something together.
Right. And this whole study just powerfully underlines how vital culturally sensitive training is,
Yeah.
and providing practical support like interpreters. It's not optional.
Yeah.
And it also really highlights how important sustained engagement is, sticking with it and building that trust within diverse groups. You could see it in the feedback. People wanted to keep learning, and they really saw that working together was key for making real change.
And they even checked back in later, right? A few months after the training.
They did. 4 months later, they held a debriefing, and the momentum was still there.
Really?
Yeah, participants were talking about concrete plans, collaborating on campaigns together to tackle the specific health issues their communities were facing. It showed that training had a real, lasting impact.
So the big takeaway here seems to be that this kind of thoughtful, culturally aware capacity building does more than just teach skills. It actually fosters unity, collective power through that shared experience.
It really does.
Yeah.
And makes you wonder, doesn't it, if Simply helping people feel comfortable and connected can make such a difference in equalizing engagement and deepening learning.
Yeah.
Well, what are human elements are we maybe overlooking when we try to tackle these big, complex societal problems?
That's a powerful thought to leave folks with. How much more potential could we unlock just by focusing on connection? Makes you think.